I'm Victor Nonyango Otieno from Inoka Success Youth Organization, co-founder and the director. We've worked with Meta Kenya for close to 3 years now. And basically we are working on the line of access to SRH commodities. And we got to learn about the research that Meta Kenya was doing from the inception, because we participated in the process, we participated in the validation, and then the dissemination. And after that, we took the initiative to go through that concept, the research itself, and we look at the gaps that were identified, because Kisumu was one of the counties that took part into this. And I want to say that we were more moved into how the availability and the accessibility among young people when it comes to the commodities. So when we sat down, we realized these gaps. We look at the recommendations that were calling upon the government to at least allocate more finances for sexual reproductive health commodities, to facilitate youth-friendly centers, to work on the ways in which youth can be able to access this commodity in a more easy way. And so we involve our team in developing a concept shared with our partner, Women Deliver, who came into board and actually supported the project that was advocating for more financing for SRH commodity within the county of Kisumu. We managed to bring on board the key stakeholders, that is the civil societies organizations. We managed to bring on board the county assembly. That was the first meeting that I saw all the budget committee in the county assembly and the health management, the health committee attending together with the executive. And we agreed that come the year the financial year 2020-2021, they are going to increase. And indeed, we can say this year we have a budget of 60 million for the RAMCA, that is inclusive of reproductive health matters. And we are seeing more, there is increase in allocation when it comes to the commodities. Another thing we can attest is that Kisumu County, I think, is one of the counties that is having county pharmacists only in charge of SRH commodities specifically. We have the county pharmacist, and currently we have the one in charge of SRH commodity, because they felt there is a need. Another thing that I can say is that it brought the discussion on how best they can ring-fence the sexual reproductive health budget line within the health budget. And that is something is currently in the county assembly, and we are following up keenly to make sure that no reallocation is done when it comes to matters to do with sexual reproductive health finances within the county assembly. Something that again I can say is that we were able to be the first of the organization to jumpstart the financing for SRH commodities, specifically within the county government of Kisumu. And now we are seeing more partners coming in and advocating for this. We've seen more organizations coming and developing policy brief on matters to do with SRH commodities. We are still hoping that this research is going to help us to make more decisions, to bring more partners on board, and we will request that Meta Kenya not only does the research, but uses this research to bring more interventions that will help these counties to actually pull up their socks when it comes to SRH commodity financing. Working with Meta Kenya has been great. We look forward to still work with Meta Kenya and other partners on board. We look forward to turn all this research thing to a great intervention, and even to go to other counties. I know it's not covering the entire Kenya, but we need to start thinking, if that is Kisumu, that is Narok, what of other countries which we've not managed to work in?